All right, so I just saw a video with a doctor who was commenting on another nurse who posted a video regarding the disrespect she had from a medical doctor. And she was saying, go ahead and make sure she does a report at the hospital as well as one to the medical board based on the severity of the situation. And that's what I always encourage my staff, or I always practice it. Just go ahead and do a documentation, because if you don't document certain things, if you don't document your side of the story, it's not going to be known. You understand? So even if nothing comes out of it, go ahead and make a report, file a complaint at the hospital, because she's right. Hospitals are going to be covering their doctors. They're going to cover reality, but the doctor's words is what most of the time they will go with, because you are the little nurse. Yeah, man, I really believe the little nurse a lot of times, because the doctors and the patients are always right. So go ahead and make a paper trail, document your side of the story. So just in case you need it for further reference, it is there on the day of the event. You understand? It is timestamp. And what I personally do is go ahead and print out those reports and keep it for my safekeeping. I try to keep all of them, but you see the ones that are very, very, significant, and say probably something can come out of it, just go ahead and print it out. Make sure you file the report on the same day. Make sure you tell your supervisor, your emergency room manager, or your floor manager, and you also send a copy of it to HR if possible. So that is what I would encourage persons to do, because in healthcare here, there are so many things that are going on, and at the end of the day, hospitals protect themselves, them brand, doctors are trying to protect themselves. You, the nurse, they're looking out and wondering who is protecting me. Go ahead and get your own malpractice license or insurance, so that way, in the event that the hospital drop you, the doctors start have problems with your patients that have problem with you regarding a situation that your malpractice insurance can cover, at least you have your own malpractice insurance or liability insurance that will help you. It will make you feel a little bit more comfortable with certain things in the event that situations like those get out of control and there's nobody there to cushion your back. You understand? Just go ahead and make sure you get that. Try to practice safely. Try to make sure that you're doing the right thing. Try to make sure you're document it exactly as how it goes. You understand? Document it as how it goes and follow the chain of command in certain situations based on this facility that you're at. All right. I do hope you get the point, and I do hope, we don't get ourselves tied up in any situations. But if you're being disrespected, go ahead and report those folks. Especially when our colleagues do get, disrespectful towards us whenever we're admitting care to patients. I think it is something that needs to be addressed, because, if you don't address it, it continues to be a pattern. I think that it is accepting, and so nothing is being done about it. All right. I do hope you will have a wonderful day though. Bye.